Goes down to the bronchus, correct?
Mm-hmm.
Okay. And how does breathing work?
Nose and mouth.
Thank you very much. Negative pressure. The amount of pressure in your lungs when you take a breath in is actually less than the pressure in the atmosphere. It causes you to take a deep breath, and in response, your diaphragm drops and opens the lungs up and allows air to come in. When the pressure on the inside becomes greater than the outside, guess what you do? You breathe out. The diaphragm contracts, it helps to push the air out, and you breathe back out, and then the cycle continues. Pretty easy. Pretty easy. I won't turn all the lights out. Now you are on my list. No sleeping in class. Okay, so the medications that we have are going to be dealing with. Let me get the right one here. Which one's better?
That's why we turn it on.
There you go.
The other one.
All right, don't fall asleep. So medications for the respiratory system do what? Okay, one, they help you breathe. By doing what? Okay, bronchodilation. What else do they do?
Open airways.
Say that louder. Some of them do vasodilation, but some of them do vasoconstriction. How about nasal congestion?
Yes, that too.
Okay, how about mucus?
Oh, yes.
Okay, how about allergies?
Oh, yeah.
All these things affect your breathing, don't they? When you're lying in bed, you're asleep, and you got 7 pillows under you, you're going, okay, because of Texas allergies. Okay. I think they developed all these medications for Texas allergies, by the way. They just migrated to other states. That's my theory. Now we do have two parts of the airway, as Zinga pointed out. We have upper and lower. Upper, we have upper respiratory infections. We have the common cold. Why is it common? Because everybody gets it. Etiology, rhinovirus, which means what? Virus of the nose, or virus that is comes into the body through that route. It affects the nasal pharyngeal tract. So what does that tell you? Sore throat. Why do you get a sore throat? Okay, so you get sore throat because of drainage, so what else is going on? You're getting mucus, you're getting secretions, and all the secretions is caused by what?
Inflammation.
Oh, thank you very much. Inflammation. Exactly. All this is caused by acute rhinitis, inflammation of the nasal mucous membrane. Okay. Boy, that was almost painful. So we have different kinds of upper respiratory. We have acute rhinitis that happens to affect our nose, and usually a nasopharynx area. And yeah, because of the drainage and so forth, we get it down the pharynx, down into our sore throat and so forth. Then we get sinusitis, we get inflammation of the sinus mucous membrane. Where are your sinuses?
All over.
Yeah, very good.
All over.
Long hands, right there, all over your face. You know why you have sinuses? No. No.
Opening.
No.
Just tell us.
They do all that, but you know what the real reason for sinuses are?
To make you have sniffles.
Boy, wouldn't that be still done? Whoever created sinuses was really, really wrong.
Yes.
Sinuses are actually made to make your head lighter.
That makes sense.
Ah, there's holes in your head, so you guys do have holes in your head. And then we have acute pharyngitis, inflammation of the throat. Why is it called acute? Because it's pretty? Sudden, short duration. Exactly. And there's a picture of sinuses. Almost like one of those masks for Halloween, which is coming up. As you can see, we have all the sinuses here. When you have sinusitis and you have the pressure in your face, this is where it's coming from. And then the inflammation happens, and now we get fluid buildup in the sinuses, which causes everything to clog up and causes more pain because of inflammation. And then it starts your runny nose and all that stuff, and you start blowing your nose and you empty a box of Kleenex. All because of that. Upper respiratory disorders. Common cold. In 1 to 4 days before onset of symptoms, you are contagious. During the first 3 days of your cold. So you have a short period, about a week period, where you walk around and cough on somebody, they're going to catch your cold.
And you don't even know you're sick yet?
And you don't even know you're sick yet. So you go out with your boyfriend and you get all over and then you got a cold. And Mom knows where you were. Okay. So how do we get that? Touching contaminated surfaces and not washing your hands. Viral droplets from sneezing. Do you know how far the common sneeze goes?
3 feet.
It goes 3 feet. 3 feet. Now, can I go further? I don't know. Some of you guys may sneeze really hard.
It was on Mythbusters. They said
I know how my husband
it's like everywhere.
The only thing I never figure out how come people can sneeze and go and their head, the top of their head don't come off. I just never figured that out.
Probably because of their sinuses. All that pressure goes in there.
Anyway, symptoms. You guys have all had these, so you know what they are. The common cold will last 14 days without medication, or 2 weeks with medication. The medicine right now is just to ease the symptoms. It does not cure the common cold. There is no cure yet. However, you may see one in your lifetime. They are having vaccines for viruses are coming out all the time. Look at chickenpox. We never had a vaccine for chickenpox.
malaria.
The only difference here is a common cold is made up from several different viruses, and they constantly change. And if they can figure out what the common patterns are for these viruses, they can probably figure out a vaccine for that. And we'll no longer have a common cold. Kleenex tissues will go out of business, and the world as we know it will come to an end. Antihistamine. What is the purpose of antihistamine? What's the purpose of histamine? What's the purpose of histamine?
Preventing a response?
It's an allergic reaction, but what's the purpose of it?
Inflammation.
Thank you. It initiates the inflammatory process in order for the body to start protecting itself from what it has encountered, allergens or whatever. Antihistamines basically block the receptor sites, not allowing the histamines to get in there and start that inflammatory process. Therefore, that's a good question. We have H1 blockers with the histamine. What do you find histamine 2 blockers? Where do you find histamine 2 blockers? Stomach. Very good. Very good. When we talk about the GI tract, we'll talk more about those medications which inhibit H2 production. So first generation Benadryl, they came up with the medication Benadryl, the greatest of all medications for allergies. The first Benadryl, by the way, was injected. It was not by oral, it was injected. Have an allergy? Get a shot. And then eventually came to pills, liquids, whatever else. It was by prescription only, and then turned over to over the counter. Yes, sir.
Longer lasting is the injection.
That's debatable. That's debatable. Some say that it is, some say that it isn't. Some that the effects are quicker felt. But then we have a liquid that's driven on the mucous membrane, so it goes either way. It's kind of like who's smarter, men or women.
That's a obvious.
Depends on whose research you read. Don't go there. I'm just using it as an example. We're not going to start a bar fight here today. Okay. Second generation antihistamines. You see these? Zyrtec, Allegra, Claritin.
Yep.
They do the same thing that Benadryl does, except on the bottom, non-sedating. They have little or no sedative effect. Benadryl is an antihistamine that is also used for motion sickness. What causes motion sickness? Your inner ear and the release of histamine. I thought you were going to blow that one out. Okay. So, Benadryl has a dual purpose here, or a triple purpose. You got a cranky kid on a car ride, and never mind, won't go there.
Great.
Okay, anyway.
Movies.
And the other medications were created in order to overcome the sedative effect of Benadryl. We don't have that anymore if we use the other medication. You still use Benadryl, it's still very effective. However, it does make you sleepy. Or hyper if you have an opposite effect. Paradoxical effect. I forgot that word for a minute. Questions so far? So Benadryl, it's an antihistamine, so it's going to compete with the histamine receptor sites, preventing the response. Reducing secretions, itching, and sneezing. How does it reduce all this stuff? By the receptor, but what causes the reduction in this?
Well, it makes a
Receptors are blocked so they don't trigger mucus production.
No. 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 You've already said it already before. Say it again. Say it louder. It's an anti-inflammatory per se. Okay? So it either blocks the histamines, which in turn either blocks or slows down the inflammatory process that the body is going into in order to combat whatever allergen or foreign body which is causing you to have all these issues. Does that make sense? Now, the one way that it does reduce nasopharyngeal congestion is that it does do some vasodilating. Because congestion in the nose, as we're going to see shortly, is caused by vasodilation, which causes the mucous membranes to swell up and you can't breathe. The uses, as you can see there. Acute or allergic rhinitis. There is no such thing as chronic rhinitis. Unless you're a rhinoceros, there is no chronic. It comes on and it can come on again and again, which means it's an allergic response and not a chronic condition. The use, as we say, contraindication, cautions. Is it a severe vasal or severe liver disease? Which tells you what? It's processed through the liver. Narrow angle glaucoma. What happens is we have something of a vasoconstriction, so the fluid in the eye cannot get out, and therefore you have accumulation of fluid in the eye, and then the glaucoma itself becomes worse. And urinary retention, it just affects on the smooth muscle within the bladder. Why? Because it can. Question? All right. Wrong button. Okay. Administration by oral IM, IV. Interactions. As you can see, increased CNS depression with alcohol. When Benadryl makes you sleepy, we have Benadryl with Jim Beam. You're going to be out. Don't have an obnoxious neighbor and put some Benadryl in their Jim Beam. Don't do that. Just proceed on. Okay. Avoid with MAO inhibitors. We talked about with the neurological MAO inhibitors. You can't take that with it. Take anything with that. It's just a obnoxious medication. Side effects, as you can see up here. Questions? You all got it?
Yeah.
Okay. Nursing interventions. You want to find out what's causing this allergic response. Environmental exposures, drugs, foods, stressors. Stress does cause this as well, yes. Give with food. Avoid operating motor vehicles, avoid alcohol, and use scrupulous gum, etc. for your dry mouth. Pretty simple, huh? Now you can give your Benadryl with confidence. Second generation does pretty much the same thing as Benadryl does, except you have reduced sedation, you have fewer anticholinergic effects, such as dry mouth, blurred vision, wheezing. May be taken with a moderate amount of alcohol. Not recommended, but maybe, because there is no sedative or very low sedative effect. You have to remember, though, when alcohol is introduced to the body processes alcohol before anything else. And therefore, if you take an alcohol and medication, the alcohol gets processed before the medication does. It's easier to do so. So when you're taking your Claritin with your Bud Light, just use caution. Question?
What is a moderate amount?
That's for each one of us to decide on our own.
Go test the theory and let us know when the 4 or 5 shots.
Let's see. Ask your significant other or your mother. I don't know. It's your own.
Are we doing closes or are we going to do it on?
Mother.
Whatever you're most comfortable with.
Nasal congestion
Just happened.
almost always followed by a sock monkey. Remember that picture? Nasal congestion, as you went ahead and reported. We have swelling, we have the production of the nasal congestion, the mucus coming down the back of the throat. You all have experienced this, you're miserable, and you have chicken soup in your bedroom. Nasal congestion, as we talked about before, is dilation of the nasal blood vessels due to infection, inflammation, or allergies. We have transudation of fluid in the tissue spaces, so we have the movement of that fluid, that mucus and so forth, the swelling of the nasal cavity, so you have vasodilation. Whenever there's vasodilation, the semi-permeable membranes of the blood vessels tend to become more permeable, and whatever in there gets leaks out. And now, not only is it causing swelling of the mucous membranes, it's causing more irritation. Thus, we have all the snot and everything else that goes on with it. And decongestants, we are stimulating the alpha-adrenergic receptors in order to do these things. Reduce vasoconstriction, shrink the mucous membranes, and therefore reduces nasal secretion. When you add all those three together, the first one causes the second one, causes the third one. And now your nose is not so runny. And some of the nasal decongestants that you have are, as you see on the board, Afrin, Allerest, Sudafed. Sudafed was one of the first ones, by the way. And you see how they're administered. Interestingly enough, a person can become dependent and or addicted to nasal decongestants. We see that today, don't we?
Yep.
What do they make with Sudafed? Meth, exactly. Exactly. That's why they started putting Sudafed behind the pharmacy counter, and you had to ask for it rather than pulling it off the shelf. I had a patient who came in, was miserable, could not sleep, had mucous membranes, were all swollen and terrible because he was having a rebound effect. He was not making tears, his eyes were dry, his nose was bleeding because he was taking eye drops and nose spray and oral Sudafed 4 to 5 times a day because he had symptoms. So how we fixed him, we put him in a bed and then gave him no medication for 3 days. He was a miserable pup. I learned that I had names I never knew I had before. But at the end, he got better. Yeah. Interaction. Sudafed may decrease the effects of our friend the beta blocker. May increase hypertension. That's if you're taking antihypertensive medications. It's always wise when you have to take something over the counter for a cold that you read the label to see if there's an interaction with antihypertensive medication. It doesn't always affect all of them, but it affects a majority of them. And why would it affect it? Why would it decrease, or why would it increase hypertension? Very good. Vasoconstrictor. So we're having the opposite effect that we want. Again, MAO inhibitors, you can't even breathe with that stuff. May increase restlessness, palpitations with caffeine. This does make you a little bit restless, and then when you add a stimulant to it, then we just have an added effect. No, taking it with alcohol will not prevent that. However, there's no contraindication to that. After Allerest, Sudafed, side effects on their own. Offer adrenergic effects, hypertension, hyperglycemia. Frequent use, as you can see. If you look on the package of these things, almost all of them say do not use past 5 to 7 days. Some of them say do not use past 3 to 5 days. But the rule of thumb is 5 to 7. Herbal remedies like peppermint can be used because it enhances your decongestion without affecting the medication. Yes, sir.
Hyperglycemia is not just diabetics.
What's across the board? The question was with the hyperglycemia, is that with diabetics across the board? That's across the board. However, the diabetic is the one that's going to feel the effect more than anybody.
You really wanted to get that picture.
Intranasal glucocorticoids. We have Flonase, Nasacort, Nasonex. Always like Nasonex. A bee flying around with the voice of Antonio de Banderas. Lucky the flowers. Glucocorticoids, primary action, you can see they're anti-inflammatory. We saw these when we went through the inflammation drugs. We had this category. So the use is that you can see there. And it can be used with a H1 antihistamine as well to help reduce symptoms and so forth. This is generally used for allergic reactions, or allergic response, I should say, like Texas air. There's everything floating around, especially in the winter, isn't it? When you get mountain cedar, is that in the winter?
Yeah, cedar.
December? That's coming. Yep. Yeah. And thank you for that encouragement. When it comes to anyway, it's for your allergies. So this helps prevent a lot of the symptoms from the allergy. It can reduce the allergy as a whole, and then when you use H1 antihistamines, that helps to reduce the symptoms even more so. So you feel even more happy and relaxed even in the midst of all the junk. We have one of the corticoids, dexamethasone, should not be used longer than 30 days. These medications are used for a pretty much for a local, so it's affecting the respiratory system, allowing you to breathe better and so forth. However, you use it for a long period of time, this medication, what happens is it becomes systemic, and it starts affecting other things as far as your cardiovascular, your mental status, and everything else. That's why you can only use it for that period of time. Yes, sir. It is an immunosuppressant. Very good. It said over here is that also acts as an immunosuppressor, so that the person is ill, they take it for a long period of time, and now their immune system starts acting up. Okay.
Is there a brand name to that or no?
Decadron. Thank you very much.
I-94.
Decadron. Dexamethasone. Okay, nursing consideration. Well, spray it away from the nasal septum. Why would you do that? Someone want to make a hole in it. Who said that? No. But it's a good thought anyway.